We're here with Dr. Thomas Liska from Ballantyne Plastic Surgery to talk about something that's probably on a lot of people's minds, breast enhancement. Now, I know in the past couple years there's been a lot of controversy about silicone versus saline and what's better. I know the FDA at one point had something to say about it. Can you tell me a little bit about what that is?
Well, the difference actually is what's inside the implant. The outside shell is basically the same as a silicone solid, but what's inside the implant is either saline, which is intravenous fluid, or gel, which is a silicone gel. The older silicone gels are more liquid, and the newer silicone gel is semi-solid. It's like what we call a gummy bear implant because it has a semi-solid appearance to it. Why one person would choose one versus the other really depends a lot upon the way the breast looks and feels, the age of the patient, the amount of breast tissue, and the amount of normal fatty tissue in the breast.
Now, I know you probably can't tell, but I had mine done a few years ago, and one thing that I thought was an interesting part of the whole process was when I went in and consulted with the doctor about what size to get. How do you help people decide what size they should get, A? And I guess my other question is, what's the most common size that you get requested?
Well, we want to find out from the woman what she finds is attractive, and that could vary from person to person. The most common size that women ask for is a C to full C cup size, but a lot of it's based upon person's height, person's weight, and proportion, and we try to make everybody proportional. We don't want to be too obvious unless the patient wants to have a very obvious result. We want it to look very natural.
Okay, let's talk about recovery time with breast enhancement. For example, my sister is considering getting breast enhancement done, but I know her biggest concern is she is an athlete for a living and is very concerned about being able, obviously, to earn a living and having too much of a downtime.
Sure. Well, downtime is important for everybody. There's no doubt about that. And for most women who are working outside the home, will take either half a week to a full week off of work. In order to get back to full recovery where one can exercise, that tends to be around 2 to 3 weeks.
Well, thank you, Dr. Liska, from all of us. This has been very informative and interesting, so we were glad you could be here with us today.
Well, thank you so much, Kathleen. I really enjoyed sharing the information with you.